knock, knock.
Come in.
Performing hand hygiene. Hi, my name is Christina. I'm a Harvard College nursing student. How are you today?
Good, thank you. How are you?
Good. Can you please tell me your name and date of birth?
Yes, February 26, 1993.
Okay, and what's your name?
Ina?
Nina, do you have any allergies?
No.
Okay. I'll ask you a couple of questions. Do you know where you are
Yes, I'm at home.
and why you are here?
Are you doing physical assessment?
And who am I?
You are Christina.
Okay, and what date and month and year is today?
It's November 19, 2020, it's fall.
Okay, who is the President of the United States?
For now it's Trump, but Joe Biden will be next president.
Okay, and you are awake and alert and you are oriented 4 times and your speech is clear, and I checked your height and weight before, and your height is 5'6" and your weight is 132 pounds, and your BMI is 21.3, which is normal. And I checked your vital signs, blood pressure, heart rate, respiratory rate, and temperature. They are within normal limits. And also I'll check your vision acuity. I'll check your nerve number 2 for intactness. And for that I'll use Snellen chart 20 feet away, and you'll cover one eye and close your one eye and just read with one eye and then switch. Okay? And I can see that your skin color is appropriate for the ethnicity. And I will start by taking a look at your head. Is oval, is the shape is appropriate, and the size for your body is it's normal cephalic. I'm going to palpate your scalp. Let me know if you feel any pain, okay?
No.
And I don't feel any lumps or masses, and I also check for infestation. And the hair is clean and shiny. No infestation present. And next I'm going to check the symmetry of your face. I'm looking at your eyebrows, eyelids, nasopharyngeal folds, and the margins of your mouth. Everything looks symmetrical. And can you smile for me? And can you frown? Okay, so cranial nerve number 7 is intact. Okay, next I'm going to check your vision acuity, your cranial nerve number 3, 4, and 6 for intactness. Okay, so I have this pen, you just follow the tip of the pen, okay?
Mm-hmm.
And I check for the accommodation, you follow the tip again, I'll bring it towards your nose. And the pupils are constricting and coming together. Okay. Next, I'm going to check the pupillary light reflex. So pupils are equal, round, and reactive to light and accommodation. I'm going to check your sclera and conjunctiva. Sclera is white, conjunctiva is pink. And I move forward to check your temporomandibular joint. Can you open your mouth? Do you feel any pain? And I also didn't hear any crepitism or clicking. And I will palpate your maxillary sinuses. Any pain?
No.
And frontal sinuses.
No pain.
Okay, and take a look at your nose. Is at the midline. Septum is at the midline as well. I'll palpate that. Do you feel any discomfort?
No.
Okay, check the nostril patency. Can you cover one nostril and breathe through the other and do the same thing? Any discomfort with that?
No.
Okay, that's good. Next I'm going to palpate your ears. They are symmetrical. I don't feel any lumps, I don't see any lesions, and I don't see any serum present. Did you feel any pain with that?
No.
I'm going to check your cranial nerve number 8 intactness. I'll whisper you something and you say it back to me, okay?
Mm-hmm.
Fall semester almost over.
Fall semester almost over.
Okay.
Yeah.
Beautiful plants.
Beautiful plants.
Okay. Thank you. Next, I move forward to check your mouth. I can see that your lips are pink and moist. And I'll ask you to open your mouth. Your teeth are white and all are present, and the gums are intact. I'm going to put on gloves and check the hard palate, soft palate, tongue, tonsils, and uvula. I'll just touch with my finger, okay? So I need light to see. Okay, open wide. Okay, can you bring your tip of the tongue up? Okay, stick your tongue out. Okay, good, thank you. So your dorsal part of the tongue is white, pink, white and rough. Bless you.
Thank you.
And underneath your tongue is pink and shiny. Your buccal mucosa is intact. And can you say, open your mouth and say, ah? Okay, uvula and tonsils pink and intact, no inflammation present. And next I'm going to palpate and check your glands for any inflammation. Check the parotid gland and salivary gland. And at the base of the neck, the thyroid gland. No inflammation present. And I'm going to check the lymph nodes, okay? I'll press. Let me know if you feel any discomfort. Preauricular lymph nodes, postauricular, occipital, submental, submandibular, jugular digastric, superficial cervical chain, deep cervical chain, posterior cervical chain, and then the supraclavicular. Can you shrug your shoulders? Okay, good. No abnormalities found. And next I'm going to check the intactness of cranial nerve number 11. Can you shrug your shoulders and press against my hand, against the other? Okay, thank you. And next I'm going to palpate your carotid pulses, okay? Okay. Strength is 2+, rhythm is regular, and rate is within normal limits. And I also going to auscultate with the bell of my stethoscope. And for that I'll ask you to breathe in, breathe out, and hold, okay? Again, breathe in, out, and hold. Okay, thank you. No abnormal sounds or bruit present. Next, I'm going to inspect your upper extremities. I take a look at your arms. I don't see any lesions present, bruises, pallor, redness, and I check the temperature. Your skin is warm, and no edema present. And I also check your radial pulses. They are symmetrical, regular, strength is 2+, rhythm is regular, and rate is within normal limits. And I'm going to check your fingernails for capillary refill. And I can see that the capillary refill is less than 2 seconds. The nail beds are pink, and the nails are firm. I'll check the profile sign for each nail. It's less than 160 degrees, which is normal, no clubbing present. Okay, so I'm going to check the strength in your arms. Can you bring your arms up on your back? Okay, put your hands like this. Bring them up. Put your fingers like this. Okay, pull towards you. Okay, press against my hands, okay? Squeeze my fingers. Okay, thank you. And then I'll check your elbow strength. Can you put your arms like this? Okay, pull towards you. Press against my hands. Okay, good. And next I'm going to move to inspect your chest. Your chest is symmetrical in front. Normal respiration movements. Symmetrical in the back. No abnormal movement, no palpitation. I'm going to listen to your lungs, okay? And you breathe deeper than normally, okay? Through your mouth. I'm also going to auscultate in your back. Okay, so I could hear the bronchial sounds up here, bronchivesicular at the middle, and at the base of the lungs, vesicular breath sounds. And next I'm going to auscultate your lobes. Can you lift your arm up? Okay, so I have to auscultate like 2 lobes on the left side. Breathe deeper. Thank you. And then 3 lobes on the right side. Okay, thank you. Next I will check your jugular vein, and for that I need 30 to 45 degree profile, so can you lie down for me and move your head on one side. No jugular vein distension, can you look towards me? Again, no jugular vein distension. Okay, thank you. You can come up. And I'm going to listen to your heart for 1 minute, okay?
Mm.
I'm going to touch your breast.
Okay.
Okay, rhythm is regular and rate is between normal limits. I'm going to auscultate your 4 valves. Okay, first to the diaphragm on my stethoscope. The aortic valve, pulmonic valve. I'm going to touch your breast again.
Mm-hmm.
Tricuspid valve, mitral valve, and tricuspid. No abnormal sounds present, and I'm going to auscultate with the bell of my stethoscope. Aortic valve, pulmonic, mitral, and tricuspid. No murmurs or abnormal sounds present, and I did hear the S1 and S2. Okay, next I'm going to ask you to lie down. Thank you. I will inspect your abdomen. I check the contour. Your abdomen is flat and the symmetry. The abdomen is symmetrical, and I don't see any incisions or lesions or any color, abnormal color present. And I don't see any abnormal movements except respiration movements. I'm going to use the diaphragm of my stethoscope and listen in all 4 quadrants for bowel sound, okay?
Mm-hmm.
I can hear normal bowel sounds. And with the bell of my stethoscope, I'm going to listen to the aorta and the renal arteries, okay? The aorta is 2 inch up your umbilicus. And the renal arteries are on the sides 2 inches. Not normal sounds, no bruits. Okay, thank you. Next I'm going to palpate it, okay? Let me know if you feel any tenderness or pain. Okay, I'm going to use deeper palpation, okay? Any pain or discomfort?
No.
When was your last bowel movement?
Yesterday evening.
Okay, do you usually go normally? Okay, that's good. Thank you. Nothing abnormal present. Okay, you can come up. Or actually sit like this. I'm going to inspect your lower extremities. And again, I don't see any lesions, any abnormal color. Check the temperature. The skin is warm. I don't see any varicose veins. And I check the hair distribution. I don't see hair. Do you shave?
Yes.
Okay. And next I'm going to check the capillary fill in the toes. It's less than 2 seconds. I'll check for the pretibial edema. No edema present. I'll check the dorsal pulses. They are equal. The rhythm is regular and the weight is within normal limits. And I'm going to check the strength in your legs. Can you lift your leg up? One leg. Keep it for 5 seconds. Okay, and then the other. Okay, good. Bring it on a side. Good, bring it in. The other one on a side. In. Okay, I'm going to check again range of motion. Bring this in, out, and then the other leg. In, out. Okay, and then check the dorsiflexion. Can you pull against my hands and press against my hands? Okay, good. Can you come up at the edge of the... Actually, stay like this. I'm going to check your Babinski reflex since you're up, okay?
Okay.
Okay. A little bit of reaction, which is normal, or no reaction will also be normal. Okay, thank you. You can come up. And I will check the strength in your knees, okay? Can you press against my hands and pull against my hands? Good. And next I'm going to do the sensory check. I'll ask you to close your eyes. I'm going to touch you and say now when you feel the touch, okay?
Okay. No. 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 No.
And next I'm going to check the sharp and dull discrimination. This will be dull and this is sharp, okay?
Okay.
Close your eyes and let me know what you feel.
Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Good. Okay. Next I'm going to check the bicep reflex. Make a muscle for me. I'm holding the tendon and okay, good. And the other, make a muscle for me. I'm going to press. Okay, good job. And next, relax your legs and I'm going to check the quadriceps reflexes, okay? Good. Good job. Next, I'll check your gait. Can you stand up and walk in one direction normally? And then walk backwards like heel to toe. Good job. And then stay still. And with closed eyes and feet together. Don't move for 20 seconds. Okay, Romberg test is negative. You can have a seat. Also for cerebral function, you have to do like heel to shin. Okay, good. That's good. And then come up. I'm going to inspect your spine. I can see that the scapula, hips, and gluteal folds are symmetrical. Your spine is at the midline. Can you bend forward? Okay, thank you. I can see that the thoracic spine is convex and the lumbar spine is concave, which is normal. I'm going to check the range of motion in your spine. And just don't move your hips, just move your torso in one direction. Good, and then the other. Okay, perfect. And that concludes our physical assessment. Thank you.
Hi, my name's Sarah. I'm going to be the nurse practitioner doing an exam on your abdomen as well as your peripheral vasculature.
Okay.
All right. So if you're okay, I do have a recording for the class, so I will kind of like announce things as we go through.
Perfect.
All right. Are you having or noticed any like changes with your bowels recently, or having any complaints with your bowels?
No.
All right. Any abdominal pain at rest or with eating, anything like that?
No. No pain.
All right. Awesome. So I'm gonna have you go ahead and lay back so I can do
Okay.
a good exam of your belly there. Yeah. So first I'm just kind of like taking an inspection, just looking at the belly, noting any pulsations, masses, hernias, anything like that that I can see right away. I do not note anything. Skin is evenly colored all throughout. And I'm gonna go ahead and just take a listen to her abdomen now. I'm sorry if this is cold.
It's okay.
Okay, I do note active bowel sounds in all 4 quadrants. I'm also going to take a listen here at the aorta, the renal arteries, the iliac artery, and also the femoral arteries for any bruits. We'll start right here in the middle for the aorta. Do the left renal artery. Right renal artery. Move down to the iliac. And then femoral. Okay, and I do not hear any bruits on over any of the arterial sites. Okay, as we move on, we'll do a percussion over the abdomen. Start from lower. And then I'm going to be looking for the liver span. So I'm actually going to start with my percussion kind of under the second intercostal space. I note that it starts to get dull around right here. And then I'm going to continue to percuss up from the lower portion of the abdomen. And note that we get dull again around here. So we'll measure that. And her liver span appears to be about 7 centimeters. I'm also going to palpate now. As I go through and palpate, I just want you to tell me if you have any pain, discomfort, anything like that. We'll start with a light palpation, and then as I go around the second time, we'll do a more like deep palpation, you might feel a little bit of pressure, but it shouldn't be painful. Okay.
Yeah, no pain.
And then just right under the umbilicus. Any pain, pressure, tenderness?
Nope.
Okay. So I'm going to kind of like scoop
Mm-hmm.
under and take a nice deep breath in. Okay. You can palpate the liver there. And then I'm going to come around to the other side and we will palpate the spleen. So I'm going to also have you take a nice deep breath in. Any pain, tenderness?
Mm.
Okay, perfect. Okay, now we're going to do a little bit more of a deep palpation. Like I said, you might feel a little bit of pressure, but you shouldn't have any pain or discomfort.
Okay.
Okay.
Yeah, definitely pressure, but no pain.
Okay. All right. So for this next portion of the exam, I'm going to have you kind of sit up, and as you sit up, I'm going to just be looking at your abdominal muscle, also checking for any masses, hernia, anything like that. So I'm going to have you go ahead and sit up there. Okay, we note a normal tone, normal abdominal muscles, and I don't see any hernias or anything like that. And then I'm going to have you kind of spin a little bit, yeah.
Okay.
So I can palpate the kidneys. Okay, so now I'm going to have you just kind of sit there, and I'm going to percuss over the costovertebral angle.
Okay.
So I'm going to go right under where your ribs and you're going to feel a little bit of pressure here, okay?
Okay. Ooh. Mm-hmm.
Any pain?
No.
Okay. Just do the other side now.
No pain.
Okay, good. Okay, now that we have completed the abdominal portion, I will do a peripheral vascular assessment on my patient here. So, Sophie, I'll have you just kind of spin around, please. And see if we can get this angled a little bit better. All right. Okay. So again, just noting even tone throughout, even color. I don't notice like any pallor, blueness, any discolorations in skin, vascular discoloration, any abnormal, veins popping out, anything like that. So I'm just gonna kind of feel your skin. She feels nice and warm, even throughout. I don't note any edema, any swelling, any abnormal findings as far as her skin goes. I'm going to take a look at her hands. She does have her nails painted, so I'm actually going to flip her hands over to do her cap refill assessment. Okay, and we are less than 3 seconds. And less than 3 seconds on that side as well. Do you have any pain, tenderness, numbness or tingling in your hands, toes, any of your extremities?
No.
Okay, cool. And then I'm going to just kind of take a feel for your pulse here. So starting with your radial. It's a nice strong pulse. Say about a +2. Move up to brachial. Nice and strong as well. Let's see, it's also about a +2. She has nice, even, strong pulses throughout both radials and brachial arteries. I will kind of just do a quick for your carotid. And the other side. Awesome. So for this next one, I'm going to have you kind of lay back and bend your knees a little bit so I can feel for your popliteal pulse.
Okay.
So we're just going right under the knee. Okay, nice strong pulse there. And same here. And a nice strong even pulse on both popliteal arteries. And then for her feet, sorry, you're good. Just rest. Yeah, just rest your feet. That's perfect. Dorsalis pedis and posterior tibial. And again, she has nice even pulsations through both dorsalis pedis and posterior tibials. I'm gonna have you go ahead and lay back, and then for the last portion of this exam here is a little pillow. You just rest back. Okay. Get in here. It's nice and easy. So you can lay your head back a little bit. I'm just gonna do a little inspection. Just looking for a little jugular vein pulsation. And again on this side. And then I'm also going to listen to the carotid arteries as well for bruit. Okay, everything sounds clear. I don't note any bruit, and I did not feel a thrill when I was assessing earlier. The other portion of the exam was also done with the abdominal portion, listening to the aorta, renal arteries, iliac, femoral artery, just to assess for any bruits. So if you do have any questions or concerns or anything with your abdomen or your peripheral vasculature, no. All right, thank you. Bye.